RS 32087 is a bill addressing the junk food epidemic in our country and SNAP eligibility for candy and soda. Taxpayers are currently funding a growing health crisis, with soda ranking number one as the commodity bought through SNAP. I kindly ask for a motion to introduce RS 32087 that would take a step for making Idaho healthy again.
Representative Furman.
Mr. Chairman, for motion.
Motion's in order.
I move that we introduce RS 32087, and can I ask the gentleman a question?
Sure may.
Mr. Redman, just for my own curiosity's sake, what are the chances of getting the waiver?
Representative Redman.
Mr. Chairman and Representative, I think that the chances are higher now with the new administration, but as you very well know, getting waivers granted from the federal government can be very difficult. So again, this legislation would ask our department to submit a waiver to request for that.
Representative Wheeler.
Mr. Chairman, a question, if I may.
You may, as long as it's directed towards Representative Redman.
Oh, fair enough. Thank you, Mr. Chairman. Representative Redman. I'm curious, as I read through the proposed legislation, and again, if you need to answer this question in a full hearing, I'm going to be in support of the motion. As I look at the soda definition, it feels like that may exclude things like diet sodas, certain sparkling waters, mineral waters. Are you able to speak to that?
Representative Redman.
Mr. Chairman and Representative, getting the definition was difficult, and so I think you're right. I think there will be some things wrapped into that definition that is just going to be difficult to qualify. I've spoke with a couple stakeholders that had that same concern. So really the thought is trying to, relieve the number one commodity, which is soda, from our SNAP system.
Okay. Follow up, Mr. Chairman?
Follow up?
Yes. Thank you, Representative Redman. I think that's great to hear that you're already working in that direction. Would you remind us roughly what does it cost for our department to request a waiver?
Representative Redman.
Thank you, Mr. Chairman. I actually spoke with the department and and they currently have staff there to request this waiver, so they will have no added cost to our general fund.
Committee, any Representative Thompson.
Thank you, Mr. Chairman. Representative Redman, where do we draw the line on regulating what people eat or buy with SNAP or any other funds? We've seen that happen in New York City, where they regulated soda and how much a person could buy per day and stuff like that. So what's going to prevent us from increasing these regulations? This concerns me.
Representative Redman. Mr.
Chairman and Representative Thompson, the thought with this, when it's a government-funded program, is that where we can have more oversight. If it is taxpayer dollars, then we would like to have some more oversight on that for healthy living, because I think this impacts, the growing health risk for children, for families in need, that can impact the total system.
Representative Eckberg.
Thank you, Mr. Chairman. Thank you, Representative Redman. I also will be supporting the motion, but I was wondering if you could come prepared or speak to it now. If you've worked with any dietitians, Diabetes Association, any group that would have some special dietary needs, that this could impact what they're able to purchase for those needs.
Representative Redman.
Thank you, Mr. Chairman and Representative. I actually just met with two dietitians regarding this, one of which had served with us in the past. They didn't see the language, but they were supportive of the concept of it. However, they hadn't seen the language quite yet, so I imagine that we'll be hearing more about that.
Committee, any other questions? Not seeing any. We do have a motion to introduce RS 32087. All those in favor signify by saying aye. Aye. Opposed, no. Motion carries. RS 32087 is introduced.